deadly virus. Sio kitu mzuri. Ni kitu inaua kuua.
It is a virus that affects your digestive system, something like that, from China.
Coronavirus nimeisikia, nasikia inaua watu kule China.
Much has been said about this virus, a virus that has caused stars around the world, with questions arising on the risks and solutions to the illness. A new virus that had not been identified in humans or animals before, hence novel coronavirus. According to the World Health Organization, coronaviruses are a large family of viruses that causes illnesses ranging from the common cold to more severe diseases such as MERS and SARS. SARS, which stands for Severe Acute Respiratory Syndrome, originated from a cat, while MERS, which stands for Middle East Respiratory Syndrome, originated from a camel. MERS was first identified in Saudi Arabia in 2012, while SARS broke out in 2003 in China. Both SARS and MERS are said to have killed around 800 to 900 people. Coronavirus causes respiratory and gastrointestinal symptoms. Just like SARS and MERS, the World Health Organization has named this new outbreak known to many as coronavirus.
Executive board room here in Geneva at WHO headquarters.
COVID-19 is now the name of this disease, with SARS coronavirus 2 or SARS-CoV-2 being the virus that causes it, as announced on February 11, 2020 by the World Health Organization.
First of all, we now have a name for the disease, and it is COVID-19, and I will spell it COVID-19. CO stands for corona, as you know. VI stands for virus, D for disease, so COVID. We had to find a name that did not refer to a geographical location, an animal, an individual or group of people, and which is also pronounceable and related to the disease. Having a name matters to prevent the use of other names that can be inaccurate or stigmatizing.
COVID-19 is a zoonotic disease, meaning that it is a disease transmitted from animals to humans. SARS coronavirus 2 was first detected in Wuhan City, Hubei province of China on 31st December 2019, initially thought to be pneumonia. The latest statistics from the World Health Organization by the time of airing shows at least 77,042 confirmed cases of COVID-19, with more than 2,445 deaths in China. There are more than 920 confirmed cases of COVID-19, with 3 deaths in 25 countries outside China, with only 1 case reported in Africa, that is in Egypt.
Given the huge population involved and given the unusual nature of the pneumonia, but which was quite similar to influenza on presentation, it's quite amazing that the signal was picked up. Obviously, when the outbreak is over, we can go back and look, and all emergency response, we've seen it in all kinds of emergencies and crisis. When you go back, you will always find things you could have done better. And if anybody involved in crisis management tells me different, I can tell you, after 25 years doing that, that is the truth. But now is not the time for recrimination. Now is not the time for forensics. Now is the time to fight this virus.
Wale watafiti wasaidie sana sana, isiingilie Kenya, isiue Kenya.
From the last time I was at the airport, I know there were some screenings they were doing. So I think that's something they've started doing, which is really good. On the other hand, I haven't heard of anything else that they're doing. Any safety measures I've not heard. If they're restricting people from coming in the country, I do not know. But all I know is I heard the screening at the airport is going well, and that's it for all I've heard. Precautions have to be made before they're allowed into the country. They get tested, they're clear, they come in.
Serikali ya Kenya ikiwezekana, mtu yote anaingia Kenya kutoka China kabla hata hajanini asikiriniwe, na ikiwezekana akifika Kenya bado kwa airport asikiriniwe kabla hajaenda mahali alikuwa anaenda kufanya kazi.
Whereas there's been suspected cases of the virus in Kenya, there's no confirmed case of COVID-19.
As a government, and then, we have been really concerned about the outbreak of this coronavirus, which has been designated as COVID-19 in China. And we have put in place elaborate measures to ensure that there is no importation of this virus into the country. And we wish to state here categorically that to date, there has been no confirmed case in the country. We wish as government to assure the public that the degree of preparedness is at the highest level possible and that there should be no cause for panic. Continuous surveillance, monitoring and screening has been heightened on all entry and exit points and all health facilities and communities. So all measures have been put in place to ensure that we are in control and we are in a good place. There is no point to panic. There is no need to worry. As government and as a country, we are on top of this. But again, we must also appreciate that we are part of a global system, and therefore events that are taking place in one part of the world certainly will impact on us as a country. And therefore it is important every time to take note and to monitor events as they unfold in other parts of the country so that we are not caught unawares.
The concerns of many countries across the world about COVID-19 borders the disease being declared a pandemic. It has led to reduced movement in and out of China, affecting many countries' economies. However, the World Health Organization has termed COVID-19 as a global health emergency.
If we invest now in rational and evidence-based interventions, we have a realistic chance of stopping this outbreak. We have a window of opportunity. Maybe you're tired of me saying window of opportunity, but there is a window of opportunity. More than 40,000 in China, while in the rest of the world, it's only in the 300s, and only wonders. You strike hard when the opportunity is there, when the window of opportunity is there. So that's what we are saying to the rest of the world. Let's be serious in using the window of opportunity we have. We shouldn't lose this opportunity. If we lose, we will regret it. And the opportunity was created because of the serious measures that China is taking in Wuhan and the other affected provinces. That is slowing the spread of the virus to the rest of the world. But I don't think this status can stay the same for long. That's why we have to use the current window of opportunity to hit hard and stand in unison to fight this virus in every corner. If we don't, we could have far more cases and far higher costs on our hands. And I don't think anybody wants that. This is a common enemy, and we have to fight it using this window of opportunity and fight it hard.
To reduce the threat of COVID-19, the government of Kenya, through the Ministry of Health, has put in place preventive measures.
And first of all, it is important for us to appreciate that this is not an issue that touches on Ministry of Health alone. It has got so many facets to it, and therefore to deal with those other facets, the government has been able to put together a multi-agency approach to this. And therefore there's a team that brings together various ministry departments to look into strategies on how to address this coronavirus issue. And therefore, from a government point of view, we are approaching it from a multi-agency concept, not an individual ministry concept. And that explains really why we have Mr. Gogo from Kenya Airport Authority and also Dr. Patrick from the Ministry of Health. As a government, we already have a national contingency plan to guide implementation of priority, preparedness, and response activities in view of potential threat posed by the potential for importation of this virus into Kenya. And therefore, we have a national contingency plan that has been put in place, and a contingency plan would mean that if there is need, all we need to do is not to go back to the drawing board, but just to bring up that plan and implement it. So, and that's what I'm saying, that we are in a good place. There is no point to worry. We are in control of every situation. The government is fully prepared with the necessary facilities to be able to deal with any danger that might arise. We also have activation of emergency operation centers that is closely monitoring the evolution of the outbreak in China and the rest of the world. So there is a center whose role is just to look at what is happening, in the rest of the world. Additionally, we have trained response teams that are on standby to investigate and alert in the country, any alert in the country. Further to that, we have in-country diagnostic capacity at the National Influenza Center and KEMRI laboratories to test suspected cases of the virus. What that simply means that we are now able to test any sign of infection here in the country. Unlike before, in the early days during which we were taking samples out of the country. Now that does not happen anymore. So we can see we're actually being able to upscale our capacity in as far as dealing with this situation is concerned. So the period between the time the sample is given out and the time the test results are brought back is at the very most 48 hours. And that is a major, major improvement. We have also undertaken mandatory screening at all points of entry to minimize the risk of importation of the virus from affected countries. So we have in total 34 entry and exit points, and all of them are manned. So there is no way anybody is going to enter into the country without being screened. Additionally, we have been able to sensitize health workers in both public and private health facilities and at points of entry on how to deal with suspected cases. So all those people you see at our point of entry have been trained on how to be able to handle any suspected case. Additionally, health workers have been deployed at Jomo Kenyatta International Airport. That is our busiest airport, so we've got a lot more personnel there than these other airports, or these other ports in the country. But certainly we've never forgotten our seaport at the Port of Mombasa. We have also a similar team deployed there to ensure that nobody is coming in to the country that will get into the country without being screened. We have also established isolation facilities that have been set up at Kenyatta National Hospital and Bagathi District Hospital to be used to isolate suspected cases. There have been consultations with private health facilities within Nairobi County or Nairobi City to support provision of additional isolation facilities in the event that the country needs that. Beyond that, we also have procured additional 5,000 personal protective equipment with support from USAID. Because you need the gloves, you need the masks, all the necessary support equipment. You already have 5,000, that have been procured to aid in that direction. But I think, and as a government, we believe that preventive measures are also equally very critical.
In addition, Kenya is working closely with the World Health Organization and CDC Africa to ensure COVID-19 does not find its way into the country.
We have mentioned also WHO, we've talked about USAID, and therefore, in order for any government to effectively deal with this situation, that we are preparing for, it is important to collaborate with other agencies. And as government, we have been, in very close consultation with the Chinese embassy here in Nairobi. We've also been in close contact with our embassy in China for daily updates on situation in the country. Through our mission in Beijing, we are in contact with the Kenyan students in Wuhan and have managed to secure medical services to those in need.
Once infected with SARS coronavirus 2, a person takes between 2 and 14 days to show full symptoms of COVID-19, which includes fever, cough, shortness of breath and breathing difficulties. In more severe cases, infection can cause pneumonia, severe acute respiratory syndrome, kidney failure, and even death. The methods by which it can be transmitted includes droplets when an infected person coughs or sneezes, touching someone who is contaminated with the virus, or getting in close contact with animals carrying the virus. SARS coronavirus being a novel virus, there is no known cure yet. However, we can prevent its transmission through simple rules of good health and etiquette. Cover your mouth when you cough or sneeze. Avoid close contacts with infected persons or anyone showing illness or respiratory illness such as coughing and sneezing. Washing your hands with soap and water, and cook your meat properly before eating. Some of the efforts in containing COVID-19 includes development of vaccines and therapeutics, enhancing basic public health interventions that can prevent infections.
I was very encouraged to see the energy and the speed with which the global research community has taken up this challenge. As we speak, research groups are meeting with the leading research funders to start work immediately on the most pressing questions. Some of these issues include easy-to-apply diagnostics, the best approach for infection prevention, potential therapies that could be used to treat patients, existing vaccine candidates and how to accelerate them, and how to address the infodemic. We're also doing deeper investigations to identify the source of this virus and to prevent further transmission from animals to humans. WHO is now developing a master plan for coordinating clinical trials and ensuring they're done coherently and consistently. Meanwhile, we continue to support countries with the tools and equipment they need now to diagnose cases and protect health workers.
Will the coronavirus outbreak run its course as SARS and MERS did, or will it become an endemic cause of viral pneumonia? Aida Munzatsi for KAK TV.